Hello, everyone. Dr. Van Merkle, and I'm president of Science-Based Nutrition. And here's a little update on an article I saw on USA Today, August 30th, as you can see there on the PowerPoint, in 2019. The title was U.S. discards thousands of donated kidneys each year as patients die on wait list. Sounds like a good article to review. And I just looked at it, and thousands of kidneys are being thrown away. I've highlighted some things in red. The whole article is pretty interesting, but some things I want you to think about. In the U.S. discarded almost 18% of the kidneys it recovered, while France discarded only 9.1% of the kidneys it recovered. In all, United States threw away almost 28,000 donated kidneys in a 10-year period. But nearly 100,000 Americans are waiting on a kidney transplant, and 12 people die every day. Okay, pretty common stuff. The point is, why do we have so many people waiting on a kidney transplant? Why do we have so much kidney disease? Some interesting information you need to know about. 15 to 20% of kidney function left and have virtually no symptoms. If you are waiting for kidney symptoms to start testing to see you have kidney disease, you're waiting till it's too late. And you don't need, until you're in end-stage kidney disease, you have no symptoms. 20% left is all you need to have kidney function, have no symptoms. By the time you get down to, well, a lower percentage, right, less than 20%, 15%, you're looking at dialysis. Now let's read about dialysis. Let's get information about dialysis here. But the question is, why is somebody, before I get to dialysis and how hard it is on the system, let's just read a little bit, that kidneys discarded in the U.S. were on average 36 years old, whereas kidneys discarded in France were 50 years old. So the kidneys in the United States, on average, are younger than the kidneys being discarded in France. Okay, it means France had a higher kidney acceptance rate from older donors. So if you're old, doesn't mean you're necessarily disqualified from donating a kidney. And so why is dialysis so bad versus getting a kidney transplant? Well, here it is. The mortality rate for patients that go on dialysis is about 20% annually, which works out to be a 5-year survival rate. So if you're on dialysis, generally 5-year survival, it's basically a slow death. And so the idea is get you a transplant, because commonly people live longer on a transplant than on dialysis. It's just interesting to note that it's comparable to some of the worst cancers we see. The average lifespan of a kidney transplant is 12 to 20 years. So dialysis 5 years, if you can get a transplant within probably the first 3 years, and you get a transplant, the average lifespan is 12 to 20 years. And so a living donor kidney is generally 12 to 20 years, but a deceased kidney donor only lasts 8 to 12 years. So obviously, United States, why not be very selective for your patients so that they maybe get 10 years of life instead of a shorter number? So I can understand why doctors may be a little more particular, because they want the best outcomes for their patients. So they're waiting till they get the best kidney possible so they have the longest outcome. At least that's maybe one thought. What happens when transplants fail? At 10 years, only half the transplant kidney patients are still working. So on average, you get 12 to 20, but only half of those make it to 10. That's not great numbers, but still longer than 5, so that's why they're doing the transplants. And the study concluded that those kidneys that are discarded, that many of those that are discarded could be used, would have generated an extra 132,000 years of life. It sounds really good, but what does that life mean? Doesn't mean optimal life, or it just means you didn't die. Doesn't mean quality of life. Maybe if you're the patient, doesn't matter the quality, at least you're not dead. But how much is it costing? I know it's a difficult subject. How much is it costing the taxpayer and the family for those extra 132,000 years of life? Excuse me. The main point in the article is, although France is accepting lesser quality kidneys, Europe has better kidney survivability outcomes compared to the United States. So the 5-year, 10-year kidney transplants rates in Europe were about 77%, while in the United States survival rates were only 56%. Or Europe has a 21% better results than the US using inferior kidneys. Why would that be? Really, that's what they're saying. That Europe has better results using older, inferior kidneys. So, there may be some reasons. According to the National Kidney Foundation, pressure to accept higher quality kidneys comes from hospital administrators who want to keep costs as low as possible. Admirable, but even this is not resulting in better outcomes. Okay, if you get a healthier kidney, you should get better response, fewer hospital days as the patient recuperates. There's also regulatory pressures from Medicare, which requires doctors to have a high level of transplant outcomes. So this too is going to require doctors to be more conservative, more discerning when choosing to accept or reject kidneys. So they're going to cherry pick only those kidneys with the best odds of a good or great outcome. But this too is not resulting in better outcomes in the United States. So transplant centers have a right to refuse kidneys for any reason, but they must make the decision in 60 minutes. So you got a kidney sitting there dying. If it's not accepted, it's not hooked up to a blood supply. You get 60 minutes to decide if you're going to take it. If not, then the guys get shipped to another transplant center. So they can refuse a kidney and they can slow the whole system down for someone to be able to accept the kidney. So out of 2.4 million people who die in the U.S. each year, only 15,000 can be organ donors. Why only 15,000? And I read an article in USA Today, I think I've got it over there, where people are wanting, where the transplant centers are wanting live people to donate parts of their liver and kidneys because they have better outcomes. I would ask those people who are wanting us to do it if they have done it. They want us to just go and donate live kidneys. Well, there's been some countries around the world where that they basically bought the kidneys from healthy people. Anyway, the U.S. is more selective and accept younger kidneys that are less diseased. At least that's the idea. That's what it's supposed to be, but Europe, even then, is still getting better results. It found that 5-year 10-graft survival rates were better than in Europe. So the question is, if Europe's doing so much better, they're using older, less healthy kidneys than what we are, why don't our medical experts go to Europe and see how they do it? How are they doing something better than we are when they're over here in the States? They're trying to cherry pick and get as good results as possible. Okay, I've got some reasons why the U.S. may be having poorer results. Overall, poor health of the donor due to obesity, which is in the United States, we have more obesity than anywhere else in the world. So if you get a kidney from an obese patient, is that kidney less durable or desirable? The number of drugs being used in the United States per person is more than anywhere else in the world. So maybe you get an obese patient with a patient who's been on a lot of drugs, even though the kidneys are younger, they're actually worse. And the types of drugs being used by the donors, we're on more blood pressure, more statins than anywhere else in the world. Opioids, do we have a problem here in this country with opioids? Probably worse than anywhere else. We also have a lot of toxicities, industrial, chemical, heavy metals. I believe are all factors into why our kidneys that are being donated are not as healthy, even though they're younger, than the ones in Europe. There may be other factors too. So, if we realize that only 15 to 20% of kidney function is left and have virtually no symptoms, what should we be doing? I mean, haven't you noticed that all at once somebody's your neighbor, somebody's waiting on a kidney transplant like that fast? It's taken years to develop kidney disease to that level. Years, at least many, many months. So really, instead of looking for more kidney donors, what should we be doing? We should look for ways to reduce and avoid the need for kidney transplants. What a novel idea. So, but there's some easy things to do. Some very easy things to do that will greatly reduce your need of ever needing a kidney transplant. First of all, the objective things. Get a dipstick urine test every 6 months. LabCorp does it. They cost about $15. Go to a doctor's office like my clinic. I think we charge $12. But anyway, very inexpensive. Do a dipstick urine test to see every 6 months. The American Diabetic Association says everyone over the age of 30 should have a dipstick urine every 6 months. Even children are developing kidney disease and other diseases that show up on that dipstick urine test. We actually start testing them as soon as we can in our clinic. Even infants should have it done to see if there's any protein or any problems seen in the urine. I do a comprehensive blood test once a year. Actually look at the kidney markers, signs of infection, inflammation, other things that could cause or contribute toward kidney disease. And the blood test should obviously include a BUN, blood urea nitrogen, and creatinine. When those are elevated, they are indicators of developing kidney disease. And then from those and the patient age, they calculate the GFR. The lower the GFR, the sicker you are. Generally, GFR should be around 80 higher. Lower the number, the more serious the problem. But those are calculated based on the creatinine. Secondary, reduce or optimize your weight. Reduce all drug use. Reduce heavy metal exposure. And reduce chemical toxins. Reduce your exposure to cleaning materials, industrial, agricultural, especially pesticides and herbicides can cause kidney failure. So, what you need to do, go to an SBN doctor like myself. You're welcome to call my clinic. Go to sciencebasednutrition.com where you can find a doctor in your area. I train doctors all over the country on how to do advanced laboratory testing. And we've had patients with even serious problems, even serious kidney disease. If we can catch it before they're on dialysis, there are times where we can reverse kidney disease by reducing the factors that may have caused it. Maybe the kidney can heal, repair, regenerate. Once you're on dialysis, it's very difficult to get someone off dialysis once they're already on it. But if we can catch them just a little bit before they're on dialysis, and hopefully catch it when it's just a little problem, because the earlier you find a problem, always the better results you'll have. So I hope this has helped. Keep your kidneys healthy. You get 2 pair. Any repair parts they put in you are not going to be as good as the ones you're born with. And even if there's chronic kidney disease in your family, where you get cysts or other problems, those many times we have patients where they have actually gone into remission and or not gotten worse. So we'd be happy to help you. Contact our clinic or contact Science Based Nutrition, the website there below. And we would be honored to see if we'd help you with your health problems. I'm Dr. Merkle. Have a good day and take care of your kidneys.